Well, here we are again. We didn't want to be here for the November meeting, but things have developed, and so we're doing another socially distanced virtual meeting, which will be broadcast to the patients. Thank you very much for coming, and I've got lots of questions here from the patients. And the first thing that everybody wants to talk about is the pandemic, and how is this wave compared to the last, and what's going to happen.
I think in terms of what's going to happen, I think none of us really know the answer to that question. There's still a fair bit of uncertainty, except that I would say, certainly from my experiences, I think we have to assume that the virus is everywhere now. I think certainly before there was a feeling that local cases were fewer and far between, but there's certainly a lot of local cases and outbreaks all around Shropshire now. And so really the emphasis is on us all following the guidance on social distancing and hygiene all of the time for the foreseeable future. I think certainly our feelings are probably over the next few months we're going to have to do all of that. There is hope as we go through the winter though, with the vaccine on the horizon. We don't really have any details of that, how that's going to work yet, except that they are planning an introduction of the vaccine to the most vulnerable groups first. That may be the logistics, how that's going to happen, we don't really know yet. But I think we've all got to continue to be very careful. Patients do seem happier to come into the practice, and we're happy to see them. We want to be they're coming in for any health concerns that they've got. We must make sure we're not ignoring other health issues. There's a question here about shielding. I think that's not official government guidance at the moment, but I think patients in vulnerable groups do need to be very careful and ultimately need to make their own decisions about just how far that they take that. But they do remain vulnerable, so we must still be careful.
There's good news about the number of the different vaccines that are going to be available, and I think everybody's feeling a little bit more optimistic, but we have to wait and see. We just have to be patient and keep up with the measures that we're all taking now.
Definitely.
Yes, right. What about the flu vaccinations for the ordinary flu? We spoke last meeting about there being a national rollout to the over 50s. I've got some questions about that.
I've only rang this morning to clarify when we could order those flu vaccines for 50s to 65s, and unfortunately there's still no word that they still haven't released it yet, so we can't order them. That will have to be a central government decision where that's going to take off. As for our flu clinics, they've been well attended, and this Sunday is going to be the final large flu clinic where we'll see about 200 to 300 people, and we will finish off our supply of flu vaccinations.
Right. So if they haven't got an appointment, if patients haven't got an appointment on Sunday, that's
But
it. Then
yeah,
really.
unless we have
Yes.
to get more, but to get more may become
Yes.
a little more difficult, but not impossible.
Yes. So presumably your uptake is higher this year.
Yeah, much higher than last year.
Yes. Yeah.
And we've come Sunday, we would have reached our target for both the two groups.
That's fantastic. That's great. I think even I'm having one this year. And I have got some questions about test results and testing. Firstly, around results being sent to patients electronically through the patient access system. Is that on the cards at all?
No, it's not available at the minute. I know some practices do it, but we feel that we would like to discuss results with patients rather than patients being given these results and sometimes patients can be on the either side of the range, and they can get very worried if somebody is on the lower side or on the higher side, and they still will need an explanation for that,
Yes.
that they don't have to worry. So if you just give somebody the result and there's something like that, I don't think a patient is going to feel reassured.
No.
In fact, it would just add to the anxiety.
Yeah. Yeah. Okay. Right. There's also a question about urine testing and how quickly patients get the results of that if it's sent off to the lab.
It can be anything from 1 to 3 days.
And why is that a difference? Is that demand at the lab or is it different tests?
It's got to be cultured.
Right.
So they put it in a petri dish and have to see what organisms grow.
Oh, I see. So it's right.
It takes a little while.
Depending on the bug.
Yes.
Okay. That probably explains that. And then I've also got a question about CA125 testing.
CA125 is a protein found in the blood. Its main use has been to monitor treatment for ovarian cancer because it is found in 80% of advanced ovarian cancer. So when you go for treatment for ovarian cancer, they monitor it to see your response. So it gets better and they know the treatment's working. So its main use has been in that regard. However, the marker, it's called a tumor marker. So the tumor marker can also be raised so not just in advanced ovarian cancer, but also in other malignancies such as pancreatic cancer, colon cancer, gastric cancer. So it's found breast cancer. So it's found in other cancers as well. So it's not a very specific tumor marker. But additionally, it also can be found in non-malignant situations. So it can be raised in benign ovarian cysts, fibroids, and even menstruation and pregnancy. So it's not specific at all in that situation. The other problem with it is it can be normal in early ovarian cancer. That's the danger. So that's why it's not being used nationally as a screening for ovarian cancer, because you get a normal result and you think you're clear. So, and that's more dangerous. So what we do now is, if we find somebody who's come with symptoms, I'll get into that in a minute, and we do a blood test like this because their symptoms sound a bit suspicious. If it's borderline, we actually send you for a scan, ultrasound scan, to see what you find. But sometimes even that can be inconclusive. But there is a pathway for dealing with that because there's lots of uncertainty with the tumor marker as well as the scan sometimes. So we will send somebody down what's called the suspected cancer pathway if we're still suspicious that something's going on. So we don't get all the answers from the blood test, and sometimes even from the scan, it can still be very inconclusive. So we would tell patients that if they have certain symptoms, to come and see us, and we'll go over this with you. And the symptoms would be bloating, distension, a feeling of early satiety. What that means is you feel full early. So you're halfway through your eating and you think, I really feel full. Obviously abdominal pain, and sometimes urinary urgency as well. So you feel like you're going to the toilet a lot. It may not be a urinary tract infection, it could be pressure from a tumor that's causing you to go very often. So if you've got any of these symptoms, come and talk to us.
Brilliant. That's a really fantastic explanation, and sure, I think it was a patient who picked up that information somewhere else and thought it was a miracle answer, and it obviously isn't. It's part of. Yeah, thank you. The next question we've got from a patient is about consultant outpatients and follow-up appointments, and the fact that patients who have been seeing consultants in secondary care are feeling that they're being neglected or forgotten about.
It's a problem for all of us, isn't it?
Yes.
Yeah. Creates problems all the time.
The way sometimes that we can deal with that is we drop a line to the consultant to say, here's an update on your patient's symptoms. You know, they were supposed to see you 2 months ago, but their appointment was cancelled. They've come to see us today, and it seems like their symptoms have progressed or got worse. Can you please advise? So we drop them a line. And sometimes that might end up with a telephone consultation with the team. Or sometimes we might get a response back to say, your patient will be seen on such and such a date, or you know, we might get some response back from the team in some way. So we send them an update, for instance, and hopefully things will progress from there.
It's a problem though, because they have got a huge list and not everyone can be seen. And that's important to know. And they are looking at their lists all the time, and they're trying to get people in who they feel need to be seen.
Right, so they are prioritising.
They are prioritising. And sometimes us writing a letter makes no difference at all.
Yeah. But sometimes we just call the secretaries or ask the patient, call the secretary and see what's happening first.
So this is causing you quite a lot of extra
work.
A lot
isn't
of
it?
work.
Yes.
But there's no solution to there, is there? They're in a difficult position as well.
Yes.
And we can do very little.
Yes.
They're in the list. There is a huge list. It's being dealt with. Unfortunately, we can't do much about that.
And there were horrifying statistics very recently about the waiting list for routine or non-emergency treatments and operations and things, which has just skyrocketed, hasn't it?
You know, today they said it might be years before they get back down. Anywhere near to being seen for routine, you know, non-urgent cases.
Yes.
But remember, the hospitals are still open. We've had plenty of experience recently of people who are ill, need to be seen, seen immediately, dealt with, and back home exactly as it's always been. So that shouldn't stop anyone from still, if there's a concern or a worry, come see us.
Yeah.
But they are trying to deal with it, because I know cataract operations are still being done.
I think they pay for that privately to the
Yeah.
NHS to get some people through.
So we talked a little bit about you operating in different ways at the last meeting, and I just wondered how that has panned out in terms of your actual workload and how you're seeing patients now. Are you using more video or telephone consultations, or how has it changed?
Well, I'll read out the figures and then we'll all contribute this. We did it over 2 weeks from last year, and the figures were we had 644 people came in for appointments, 104 had a phone consultation, and there were 29 visits. This year, over the same time, we had 444 appointments, 168 telephone calls, and 34 visits. But those figures don't show very well holidays, which make the numbers a bit unusual. But in fact, our workload, as it has been the same roughly all the way through, didn't it? We're still full every day, and we've only done a few video calls.
Because I think most things can actually be resolved with a photograph. So people are sending us, so if somebody's down for a telephone call and they want to talk to us about a rash or a lump, they say, "Would you send us a photograph on an email?" And quite often we are able to deal with the situation just by looking at the photograph.
Yeah.
So a video wasn't necessary.
Right. We're all having to get used to being on video, aren't we? More and more, but a lot of people are still very reluctant.
Have you had anything to add to that, Peter, for appointments? Your experience with shop doc?
Well, I think the way Shop Doc operates has changed. They're doing a lot more advice and consultations proportionately over the telephone, with relatively fewer visits, mostly to the frail elderly and palliative care patients. I think they are trying to reduce the risk of exposure of patients and medics to potential coronavirus infection, which is obviously important, especially when you're travelling all around the county.
Yes.
But it's still remaining very busy, and I would say, if you have any concerns out of normal working hours, that you don't hesitate to contact them, because they are there all the time when we're not, and they offer a very good service. So definitely do that.
Well, I think we've covered all the questions which the patients have raised, and thank you very much. If there's anything you want to say to finish off with, just any messages you want to give to the patients?
I think the main one is as we have been all the way through, we're still open. We're ready and willing to see any patients whose needs be that they need to come and see a doctor. Patients shouldn't feel worried about coming here. We keep the place clean, we dress appropriately, and it's a safe place to come.
Yes.
Therefore, if you go into the supermarket, there's an awful lot more of a problem than coming here to see your GP. So please remember, we're here to see patients when we can.
Lovely. Well, thank you all very much for your time. I'm sure the patients will value this extra information they've had from you. Thank you.
Thank you.
Okay, thank you.